Federal agency that runs the Medicaid program is threatening to withhold payments to Minnesota programs unless the state addresses widespread fraud. The announcement came on social media over the weekend by former TV personality Dr. Oz, who now leads the Centers for Medicare and Medicaid Services. Lou Raguse joins us to break down what it all means for Minnesota. Lou?
Julie, the Minnesota Department of Human Services has already added restrictions to 14 programs they've deemed high risk because of fraud. Now they'll have additional oversight from the Centers for Medicare and Medicaid Services.
We're going to crush waste, fraud, and abuse.
Dr. Mehmet Oz, the administrator of the Centers for Medicare and Medicaid Services, in this video posted on social media, blasted Minnesota Governor Tim Walz concerning fraud within government programs that rely on Medicaid reimbursements.
Our message to Walz is clear. Either fix this in 60 days or start looking under your couch for spare change, because we are done footing the bill for your incompetence.
In October, the State Department of Human Services announced it was withholding payments and auditing what they identified as the 14 highest risk programs for fraud.
You will need to prove to us that you provided legitimate services before we pay you.
In his letter delivered to Governor Walz, Dr. Oz laid out additional requirements for Minnesota to continue receiving federal Medicaid money. Provide weekly updates to CMS about its audit. Immediately stop all new provider enrollments in those programs and provide CMS with a corrective action plan.
When these scammers realized that nobody was guarding the cash register, they went gangbusters.
A statement from the Department of Human Services in response says many of the recommendations from CMS are based on work we have already started. We are reviewing the request from CMS for additional information about the anti-fraud work underway and will be connecting with CMS. Governor Walz issued a similar statement that says, in part, we are glad to see CMS affirming the governor's executive action and look forward to continuing to work together. Now, our research found that the federal government provides about half of Minnesota's Medicaid funding. So if CMS did freeze it, DHS programs would not have zero funding. However, Minnesota would likely not be able to support the Medicaid programs on the state's percentage alone. Julie.
I think that's a really important note, too, because there were some questions about how much is state money, how much is federal money. So there are programs already in place in Minnesota. Is this just going to replicate them? Is it going to go deeper than what the governor has already enacted?
Well, there adds this layer of federal oversight that they'll need to check in and let the feds know what they're doing. In addition, the timeline is slightly different because in Minnesota it was a 90-day audit and freeze on payments, and Dr. Oz says that they have 60 days. And so it'll be interesting when you look a month or two down the road here to see where things are at.
And is there any reporting they'll be doing to the public on the findings, do you know of?
That is a great question. I know that the state intended to do that, so we expect to find out the results one way or another.
All right. Thank you, Lou.